All right.
Looks like I'm back.
Okay. Thanks, Isa. I was just filling in the rest of the homes. So go ahead.
So sorry about those technical difficulties. Yeah, we do have 5 levels of care. And next slide. So basic eligibility for admission into the veterans homes is you must be 55 years of age or older or disabled. You must be a current California resident at the time of applying to the home. You must have been discharged from active duty under conditions other than dishonorable. You must test negative for tuberculosis. You must not require more care or supervision than can be provided by the veterans home that you're applying for. You must not require acute hospitalization at time of admission. You must not require acute psychiatric or have a history of violence due to mental illness or a criminal record that would create a risk to themselves or others in the veterans home community. The average age at our veterans homes is approximately 78 years old. So, you know, we're talking about elderly, frail veterans. That's why we have strict criteria for admitting anybody from the veterans home. And we try to ensure that we provide them a safe community environment when they're admitted. You must not be under the influence of alcohol or illegal substances, including marijuana. Must be enrolled in a qualified federal, state, or private health insurance plan, or have an application pending. Next slide, please. So the Veterans Homes application is a 3-step process. There's the background information, which is section A of the application. It's basic demographics, and it provides a lot of information that we'll go over in one of the next slides. Authorization for disclosure, which is a release of information for your medical records that will assist the clinical team in determining which level of care the applicant is applying for. The physician's medical certificate is another tool that's used to gauge the current health condition of the applicant that is applying. Next slide, please. So section A is basic demographics. We all know what those are. You know, they ask for your name, your address, date of birth, social security number, driver's license, birth certificate, marital status. Provide proof of current resident of California, which could be a driver of California, driver's license, or a tax, California state tax form that would prove that you're a resident of California. Military service information, which would be your DD-214. Veterans benefits section, which allows us to know if you've applied for any disability compensation, pension, etc. And then there's a financial information section that is all income that would be reported if you were filling out a tax in your annual taxes. Criminal background information, we would need to see copies of any criminal background, including police reports and all that other stuff that goes along with criminal background. And if you're on parole, we need to know whether or not you're currently on parole. History of medical care, and then home of choice section, which allows you to select based on a list of the 8 veterans homes, what your first choice would be. Say you want to be admitted to the Yountville Veterans Home, you would select that as number 1 choice. And say your second choice would be the Fresno Veterans Home, followed by possibly the Chula Vista Veterans Home in Southern California. That just helps us better understand what your preferences are as far as being admitted to one of the veterans homes. We know a lot of veterans want to be admitted close to where their family lives, so we take that into consideration. And this gives us an opportunity to be able to try to place the veteran in the closest proximity to where they live. Excuse me one moment. And of course, there's key telephone numbers for the admissions offices that are also included on the application. Next slide, please. Section B is the authorization that I mentioned earlier. It provides the name, address, and hospital or doctors that you've received care from in the recent past. need to specify all that applies, including medical information, psychiatric information, drug and alcohol history, or history of HIV. Next slide, please. Section C is the medical certificate. Again, this would be a part that you would print out and you would provide it to your current treating physician, your primary care physician, that has a knowledge of your healthcare needs. The medical certificate is valid for 6 months. Information contained on the medical certificate and copies of the medical records help the home's clinical admissions team to determine the appropriate level of care required by the applicant. Next slide, please. The admission process, phase 1, is completing all the information that we've gone over before, completing the application and the medical certificate, providing copies of the discharge papers, pardon me, allergies, copies of the medical records of previous providers, the proof of California residency, income data, proof of enrollment in the USD VA healthcare system, and enrolled in a qualified health insurance plan, which is required throughout. Recent tuberculosis screening is also required. Next slide, please. The phase 2 assessment is when we receive the completed application package, that's everything that was mentioned before. Then we have an admissions nurse that is responsible for reviewing the documents and trying to assess whether or not they, based on that paper record and the information provided, whether or not they can make an assessment as far as the level of care that would be appropriate for the applicant. If appropriate, the home will schedule an in-person assessment. We generally call that the pre-admission assessment. Information contained on the medical certificate helps the home's admission team determine the appropriate level of care. Next slide, please. Phase 3 is the decision process. So a decision is made to admit or place on a waiting list for appropriate level of care or deny application admission to the home. If placed on the waiting list, the home will be able to provide the applicant with an approximate time frame before they are called in for the physical admission. Now, the denial process that's mentioned on here is we provide applicants that are denied admission for whatever reason. Let's say they have a criminal record, armed robbery, murdered 3 people, you know, they're on parole or whatever. We deny them admission to the home. We would provide them an opportunity to appeal that denial first to the home's administrator. Within 10 days of receiving the denial notice, the applicant would be required to submit a letter to the administrator requesting a denial appeal hearing. In that letter, they should include information that may not have been considered when making that decision to deny the applicant. If the administrator reviews and has the appeal hearing and still feels that the person should be denied, then another letter will be sent to the applicant, providing them with appeal process to the CalVet board. The CalVet board governs CalVet, so if they overturn the admission, then we're required to accept their findings and go forward with the admission. If they deny it, then the admission is upheld and the applicant would not be able to be admitted. Next slide, please. Each home waiting lists are maintained for all homes at all levels of care. The number of applicants for each waiting list are fluid and vary from home to home. Skilled nursing routinely has the largest waiting times, but that too can vary from home to home, depending on their ramp-up process. Once you've been evaluated and after the level of care has been determined, you may decide to select a different home of choice, but first contact the admissions office of that home and discuss your approximate waiting time there prior to requesting your record to be transferred to the new veterans home. Next slide, please. We do have a large number of veteran applicants, predominantly on our skilled nursing facility wait list at all homes that provide that level of care. This has been exacerbated with, as everybody knows, we're coming out of a 3-year pandemic. And the one thing that we've learned is that the pandemic has really weighed heavily on the clinical staff at the veterans home, not just in our veterans home, but throughout all skilled nursing facilities that require that, you know, people get burned out from having to wear masks and stuff like that. So they end up leaving the healthcare industry to go on to something that's not as tasking for them. So currently, all of our homes, especially in the skilled nursing facilities, have large waiting lists, and bringing in new veterans is going rather slowly at this time until we can ramp up the staff to be able to adequately care for our veterans. We will continue to not admit that many people to our skilled nursing facility, but we still would recommend that you apply for those level of care in the hopes that we are able to hire more staff and improve our census overall. Next slide, please. So we created a pre-admission tracking system in Calvet in 2009, and it's been under many, many renditions, as Lewis will attest. It's been refined, and it's a system that we created because we wanted to have transparency throughout the homes for the people in the admissions office and for the administrators and folks in headquarters to be able to know how those applications are being processed. Information in regards to people that want to transfer from one home to another. The PAT system, pre-admission system, provides us the modality to be able to do all that. And we've been doing that for several years now. We consider an application to one home is an application to all homes. However, I want to emphasize, you may only be on one admissions waiting list at any given time. The system does allow the admissions offices to be able to look into the system and determine, well, if your wait is going to be 3 years in one home, you may only have to wait 6 months at another home. They do have that information that they can pass along to applicants. The applicant should contact the office, admissions office, for the home they want to go to determine the approximate time frame for admission. Next slide, please. And that concludes my portion of the process. And we will
Thank
be.
you so much for presenting, and I appreciate everyone's flexibility with the interruption that we had. Let's talk about the Veterans Home online application process. Are you ready for this, Luis?
I'm ready. All right. Good
Thank you,
morning,
sir.
everybody. My name is Luis Samayoa. I have been with Calvet for about 7.5 years. I have extensive background in nonprofits and community service, and I am currently in charge of the online application for our veterans homes. So there are 2 ways, or I suppose 3 ways to apply for a veterans home through Calvet. You can go into a veterans home and pick up a paper application, and you can just turn it in like that. You can get a paper application and send it in through mail, through fax, into a veterans home. And as of 2018, you can now apply online. All 3 of the ways of applying are all the same. They all get filtered into the same pre-application system that ISA was referring to. So regardless of how you apply, it all is going the same way. No system gets you in on the list faster or anything like that. They're all filtered the same way. So I'm just gonna go very briefly into how you apply online. And at the end, we'll go over questions, any more details that you have. I'll do my best to make this short so we can get into more broad questions and things like that. So I'll be going over how to create a My Calvet account, which was brought up a little bit earlier, how to start the application, how to submit it, and then how you can check your status on the list. Next slide, please. When you are applying for a veteran's home, you need to create a My Calvet account. So you go to our website, www.calvet.ca.gov, and you go to the login and register button, fill out the fields, submit it, and then you'll be asked to verify your email address. Just important to know here, if you are a relative or you are trying to start an application for a veteran, you are more than welcome to do it from your account. You can create an account and then you can start an application for somebody else. The only thing I will stress here is that every My Calvet account can only have one application tied to it. So if you yourself also plan to apply, then you will need to have a separate account if you're creating a My Calvet account for someone else. So let's say it's a situation where it's going to be a veteran and a spouse that are going to be applying for a veteran's home, then they will each need a My Calvet account to apply. If you are maybe the child of a veteran and you're trying to help your parents submit an application, you can create a My Calvet account for yourself, for a family member, and then when you start the application, you would just put the veteran's name in the application. So it's totally okay if you're a relative or you're helping someone out. The My Calvet account can be tied to you, but when you start the application, then you would the application would have all of the information for the veteran. Next slide, please. After you've created your My Calvet account, you will see on your My Calvet profile, you'll see a button that says View Your Veterans Home Application Status, this yellow button that you see on the screen. You can click on that, and that will take you to the screen where your application will live. If for some reason you don't see this button or you're not on your My Calvet profile, you can search on our website and just say Veterans Home Application, and it will take you to the appropriate page. Next slide, please. When you get to the page to start your application, you will be asked, have you ever applied to a veteran's home before, or to a California veteran's home before? If you have applied before, you can just say yes, and then it will prompt you for your name, your social, and your birth date. And if you've applied in the past, it will then find your old application, and now you can check the status of your application. If you're starting a brand new application, you've never applied before, then you would select no. And when you select no, you get this, which is the beginning of the application. When you get to this page, as you can see, there's only a few fields. It's asking you for applicant type. So applicant type, you're either a veteran or you are the spouse of a veteran. So we do allow spouses to be admitted into our veterans homes. And the only caveat with that is that if you and your spouse are applying, you need to have the veteran apply first, and then the spouse application would be second. This is just so that we tie the two applications together. And so that, wherever they are in the process, they go in the process together. So again, just if you're applying with a spouse, just make sure that the veteran application gets submitted first, and then you can submit right after the spouse application. That way they will be tied together. If you do them out of order, you would have to contact us to make sure that we pair them together. Anyways, when you are starting your application, you would check your applicant type. So again, for most people, it would be veteran. Then enter your first name, middle, and last, your social security number, and your birth date. Once you click save on this page, you can come back to your application whenever you would like, however many times you would like. You just need to fill out this page. If you don't finish this page, then we don't save the record and we won't have you in our system. So if you're just helping someone start an application, you're just trying to get the process starting, the most important part is to do the very first page of the application. Once you do that, again, you're in our system and we can help you out further because we will be able to see your information on our end. Next slide, please. We designed the online application to let you submit it with as little or as much information as you have. Some of the questions, relate to medical, relate to financial, relate to service time, lots of various things that people might not have easy access to. So we didn't want to put that burden on you, that stress of like, oh my gosh, I need to find this, whatever. So when you're going through the application, it's okay. If you don't know the field, if you don't know the information, you can definitely keep going and filling in what you do know. If you don't know anything, if all you knew was the beginning, what we just saw, the name, the social, and the birthday, that's okay too. You can submit an application with just that information. And once you're in the system, you submit it, then the admissions office will work with you to fill in the gaps, all the information, because eventually we will need all that information. But just getting started, you can just submit it with, again, just your name, your social, and your birthday. When you do submit your application, that will end up with the admissions home, or in the home of your first choice, the admissions office of your first choice. They will assist you getting you to the rest of the application, getting onto the wait list. After you have submitted your application, you go to the same location, the same button to where you started the application. When you go there, you will now see a copy of the application that you just submitted. This is just for your own record keeping, and also so that you know what we are looking at, what we see. As we make changes to your application, as we fill in more of the information, those will also be reflected in the application. So you'll be able to see the entire application once it is completed in the same location. And again, once your application's done, you've filled out, or you've had your screening to determine your level of care, you've selected your home, and you're all good, everything's ready to go, you'll be placed on a wait list. The wait list, right, is dependent on which home and which level of care. Once you have a waitlist number, you can go to the same location again on the website, on your My Calvet page, and you can track your number. So, let's say maybe you're number 45, you can check in a week, and maybe you're 42, or whatever the situation is. All this information is in real time. We wanted people to know, up to that moment where they are on the list. So that way you're, cognizant of how long it might take, and all the steps that you have left. Of course, once you're on the wait list, we can't really estimate a time it will take, right? Dependent on the home, dependent on the level of care. Right, we only have a certain amount of beds in every home, and so we are just waiting for all that process to go through. Next slide, please. So that's it for the online application. Again, the key part of it is creating your My Calvet page or account, and then starting the application with the minimum information. When you submit your application, before you submit it, you will be prompted with two boxes that are our terms and conditions boxes. These release, or at least give Calvet the permission to work with your application, with your medical information, etc. So again, make sure before you click submit, that the two boxes are checked, so that way we can work on your application and take you to the rest of the process. After you submit it, you will be contacted within 5 days by a admissions staff, and they will be able to help you get your application all the way to the waitlist. And thank you for your time. And now, any questions you might have for myself, Isa, Kirk, or Sean. Thank you.
Thank you so much. It's such a critical California benefit to veterans and their families. And what you gentlemen do, it changes outcomes, and it creates legacies. Both you gentlemen have over nearly 35 years of just devoted service, and you're an excellent resource and a huge knowledge base. So let's go over some of these questions. and see what we can find out. Are there any daily benefit limits for domicile care? And can it pay to neighbors taking care of a veteran?
Daily benefits. Each veteran that's admitted to a domiciliary care are required to pay 47.5% of their income. So if a veteran is admitted to a domiciliary and they have an income of $1,000, they would pay $455 to the veteran's home for admission to the home. The remainder of that salary would remain with the veteran.
Excellent. And
Each
the second
level of care has a different, percentage. So domiciliary would be 47.5. Assisted living would be 55%. Skilled nursing would be, or intermediate care would be 65%, or 60%, and skilled nursing would be 70% of their income.
And the second half of that question was, can it pay to a neighbors that are taking care of a veteran?
No. Because
No.
they're paying into the veteran's home to live in the veteran's home. So I'm not sure where the neighbor helping would be a payment. Maybe that's for like aid and attendance.
Possibly. And I'll follow up on that one a little bit later.
Hello,
Let's
can
get-
you hear me? Hello? Hello?
Yes, we can hear you.
Yeah, that was my question. I am speaking about domiciliary care. When the veteran stays at home, can his neighbors be paid if they're helping him?
Yeah, I think there's a little bit of confusion what domiciliary care is. We have 8 state veterans home. 3 of them offer domiciliary care. That means the veteran lives in the veteran's home, not in their own home.
Oh, I see. Is there any help for veterans to stay and continue living in their homes?
That's question possibly the CalTAP team. Michael?
Yes, there's aid and attendance through the VA, and you would just need to contact a county veteran service office or the VA healthcare system to apply for that. And we can put some resources in the chat that you can access, contact to your local county and how to your service provider in your region. That's your best option, is they will direct you and assist you with any application process for the aid and attendance. And there's also others for if there's a loved one or family member assisting with that, so that they can also possibly receive financial support if they're full-time caring for the veteran in their home.
Thank you.
You're welcome.
The next question coming in is asking about eligibility, and they're asking if does the veteran need to have a VA disability in order to be eligible for the CalVet home, and what is the income criteria?
So again, I think I answered the second part of that question, but no, a veteran does not have to be rated service connected in order to be admitted to a veteran's home. As long as they meet the basic eligibility criteria of an honorable discharge or anything other than a dishonorable discharge, and they honorable discharge and meet the age criteria or disability criteria, whether they have to be over 55 years of age or be disabled by the VA or Department of Social Security as a disabled veteran.
Thank you. The third question coming in is about assisted living, and if a veteran who's in assisted living and is not considered to be safe to stay at home, but they insist on staying in their home, what are the resources that might be available to address that issue?
That again is probably a CalTAP veteran representative question. They're living at home.
If they're living at home and they're homebound, and again, that would be contact the county veteran office or the local VA. There are some service providers that will assist. You need to reach out to the local service providers in your local county to help assist with that application and find where you're residing. If the veteran wants to stay in his home under doctors, or and they want to move him to, I mean, it's probably solely up to their prerogative and their wishes. They may need more advanced healthcare or skilled nursing care, and it's a discussion that the family would need to have together with the veteran to find out to care for his needs the best way possible, and while he's staying in his home.
Thank you for answering that, Kirk. The next question coming in is about someone running into challenges with being accepted into a home, and when they have the process going through and they're not getting any feedback, what's the best path for them to take?
The best path actually is for them to contact the admissions office and speak to the admissions staff there. They're in the best position to be able to tell the veteran how long it might be before they're admitted into the home. Again, as I mentioned before, all the veterans homes are having difficulties with staffing, especially the clinical staffing. With the pandemic, there was a lot of skilled registered nurses, LVNs, and CNAs that are responsible for taking care of these veterans in the homes that got burned out and left the clinical setting. That's something it's nationwide. It's not just with Calvet. It's not just with California. It's the world has gone through this process of losing a lot of people that chose the profession, clinical profession, to take care of veterans, to take care of just sick patients that have left that career path because it got burned out. So we're trying very hard, having job fairs at all the homes to try to recruit clinical staff so that we can increase admissions to our homes. We feel terrible that we're not able to admit everybody that's on the waiting list, in the time that they would like. And that's, it's a fact of life. As soon as we can get those positions filled, we can increase and ramp up the homes to our satisfaction.
So the last question we have for today, because our time is running short, is about the waiting list. They want to know, how long can you be on the waiting list, and how long specifically is the waiting list for the Fresno facility, the skilled nursing facility?
I would recommend that person contact the Fresno VA admissions office and get that information for them. They can remain on a waiting list forever, for as long as they need to be. They never lose their place. If they choose a different veterans home, they might get in sooner. But again, we highly recommend that they contact and work with the admissions office at the home that they want to choose.
I will like to jump in and just add one thing. When after you're on the wait list and you've set up your My Calvet account and you can see your wait list number online, we have also provided what your wait list, what position you would be in other veterans homes. So perhaps maybe your number one choice, let's say you're number 50, but maybe in Lancaster you would be number 2. We provide this information so that way you can change your first choice. You call the admissions and say, hey, can you change my first choice to Lancaster? They'll move you over and now you would be number 2 at Lancaster. So again, we understand that most people would like to stay close to home or stay close to family, but if it's an, you have the flexibility to be in another, out in a different part of California, there could possibly be another veterans home that has a little bit more openings in their wait list for you, and you could just move yourself to that list. So that's one of the benefits to having an online an account.
Let me reiterate something about that. The homes are constantly trying to admit residents. So in that scenario where you might consider yourself number 1 or number 2 on another list, I emphasize for you to contact that admissions office, because they may have already committed to admit their number 1 and 2 on their wait list, which would make you number 3. And some veterans say, well, I'm number 1 and according to the system, it says I'm number one. Why are you telling me that, I'd have to wait 2 months to be admitted? So the system is great. It gives you a good approximate time, but I highly recommend that you contact the admissions office, deal with the staff that are in the best position to give you the most current information possible.
Okay, that makes sense. Sean, did they ask the question about the income criteria already?
I believe we're going to run out of time, and I really just don't want to. I want to make sure that yes, they did talk about the income criteria.
And, thank you, Isa and Louis, for staying on and answering the questions. And again, folks, if your question was not addressed or answered, please, I did put some information in the chat. Our contact information slide is here directly for you to reach out to each one of us individually. We are open and here to serve you so that you can have your questions answered. So we do apologize for the short end of this. It's about 5 minutes short, but we will get your questions answered and back to you regarding the information that you are seeking. That's what we do. So again, we're going to move forward to the next slide and provide some information on some upcoming webinars. And this is just a snapshot of some upcoming virtual workshops. If you do register for My CalVet, you can actually get the newsletter and some upcoming information and register online. We do have some valuable webinars coming up and some really great resources. Next month, we're highlighting emergency preparedness, how to prepare your home and how to stay safe in disaster relief and emergency preparedness, wildfires, floods, earthquakes, etc. Next slide. And again, this is our survey. We do ask that you do take a couple minutes to fill out the survey. We value that feedback and information from you so that we can continually improve these webinars and processes so that we can meet your needs and what you're looking for, specifically to your benefits. So how to access them, please fill out that survey and provide some feedback. Next slide. And